Looks like we're streaming now. So thank you, Brian.
Yeah, you're welcome. Should be up there.
Did you, Laura, do you want to share your screen
Yeah, let me share my screen. Oh,
can we give Laura the ability to do that, please, Brian? Brian's got
he's got the magic.
he's got the buttons. Thank you for doing that.
Yeah, it should be good to go.
All right. So I guess we'll get started. Thank you, everyone, for coming here. We have Laura Pelosi, who's going to give us kind of a rundown on workforce challenges and opportunity. This has come up a couple of times in our caucus over the past few weeks. Next week, we don't have caucus. We're not here, but I'm going to be working on looking at some housing, someone to give a presentation on housing when we get back, so we can talk about that. So I'll leave it right now to Laura. Thank you. Turn it over to you and be respectful of your time. So thanks for making the time to be here.
Absolutely, it's my pleasure. Laura Pelosi. For those of you who know me, you probably know me primarily from my work with the Vermont Healthcare Association, which is the trade group for our long-term care facilities. That includes our 37 skilled nursing facilities, 112 residential care homes, and 15 assisted living residences. I also work with the VNAs of Vermont, as well as Bayada Home Health and Hospice. And I also do work with the Hospital Association. So I kind of have a very broad perspective on these workforce issues. Back in 2019, the legislature created the Rural Health Services Task Force. I'm just going to give you a little bit of a brief overview of that and then provide you with some data. I'm going to largely use the skilled nursing facilities as an example because we have the most recent data for them in terms of costs and some other things. But it in no way suggests that this workforce need does not exist across the continuum of care. There is a very significant need for all of our providers with respect to workforce. But in 2019, the legislature created the Rural Health Services Task Force. I chaired the workforce subcommittee for that group. And the reason for that was that about 4 years ago, the nursing home's priorities just really flipped on their head. It was very clear that, I'm getting some feedback. Very clear that workforce was their top priority and that they were really struggling with their ability to access nurse aides and nurses. So I provided links here to the full report of the task force, as well as the workforce subcommittee report. Just briefly, what you'll see in there are a lot of great charts and graphs that really demonstrate the points here. We have an aging population. I don't need to tell this group that. That also means an aging healthcare workforce with an increased demand for healthcare and long-term care services and supports. At the same time, we have a decline in the number of our licensed professions, and the data is all there in those charts and graphs. It's pretty stark. And we're facing a very tight national, regional, and local labor market, in addition to rising educational costs for our healthcare providers and costs of living. Some of the things that you'll see identified in that report are challenges around the typical economic development issues of childcare, housing, and transportation as being barriers that the healthcare sector faces in terms of recruitment and retention of workers. Our current nursing workforce levels, you can see here we've got 14,600 plus individuals working in the fields of registered nurse, licensed practical nurse, licensed nursing assistant, and then home health aide and personal care attendant. So you can just kind of take a look at some of the demographic information if you want to click on any of those links. You'll see in this AHEC, this RN relicensure survey, which the survey is actually done by the Board of Nursing every year. The most commonly reported age for an RN in 2019 was 61 years old. As part of the work of this task force, we built on some ongoing survey and analytical work that had been done the year previously. We identified a need for 5,000 nursing-related positions by April of 2020. So we did this work pre-pandemic. I think the pandemic experience has demonstrated that we were spot on. All you really have had to do is turn on the TV or, look on the internet to see that nationally, and certainly in Vermont, we are struggling to find the nurses that we need to be able to provide the care that we need to be able to provide. And this is across the continuum again. We think it's a pretty conservative and low estimate that incorporates both new positions and replacement positions for anticipated retirements. But again, that was pre-pandemic. I think there's some concern that once we get through the crisis, we will see a bit of an exodus of our licensed professionals who may have been nearer to retirement. It's been a very stressful time. You all know this, unlike retail or other sectors, healthcare provider, we can't cut the operating hours. We can't install self-checkout kiosks. You need people to provide care to people. Many providers have regulatory staffing requirements, and if we don't have enough staff, you can't see patients. We saw this really play out through the pandemic in terms of the ability of hospitals to discharge patients, particularly to skilled nursing facilities. We had facilities that simply could not get the staffing they need. And back in the fall, we had to request some funds from the Joint Fiscal Committee to help facilities in the Burlington area staff 40 beds so they could help decompress the medical center. They had a backup of nursing home level of care patients that needed to be transferred. I'm going to get to the traveling nurse piece. So one of the easiest measures that we can point to demonstrate the impact in terms of our challenge with nurses is our expenses for traveling nurses. So you might remember I said when I first started this presentation that about 4 years ago, the nursing home said, we have to do something. Something's going on, in the workforce area. We cannot get nurses. So that's roughly fiscal year 17. And you'll see between 16 and 17, there was a significant increase in the amount of money that nursing homes were having to spend on travelers. At the time we did the Rural Health Services Task Force report, we had the fiscal year 18 data at just about 12.5 million. I just over the last month was able to get the updated information for fiscal year 19, and you will see on this slide that it doubled in just a year from 12.5 million to just under $24 million. And this was pre-pandemic. I don't even want to see the number, to be quite frank, for fiscal year 20 and 21. And we won't have that data that'll start coming in the summer. But this has been a crippling expense for not just skilled nursing facilities, but also for hospitals, also for home health agencies. And the bottom line, in recent months, we haven't even been able to attract traveling nurses, given the intensity of the outbreaks that have been going on across the country. We've had to pay not just standard traveler rates, but crisis traveler rates. $110 an hour for a nurse. It's not sustainable. It's not affordable. And providers don't have the cash flow to be able to do that. And because we don't have enough of our own nurses, this is what providers are left to do at this point. So, what are our strategies? On the front end, we have to get more folks into the pipeline to be nurse aides, to want to go and be an LPN or an RN. So we need some strategies to attract people into our programs. We also need strategies to keep them when they graduate. And so you'll see here, I spent some time working with our nurse education programs to get a sense of what our retention rates are. I'll just go to the bottom line. At the end of the day, we retain, or I should say, I like to frame it as we lose 30% of our nurse graduates every year. For 2019 and 2020, that turns out to be about 255. Based upon current enrollment, if we continue to lose 30% of our Vermont educated nurses, we're going to lose over 450 nurses. That's 450 nurses we would like to keep here in Vermont and find strategies to be able to incentivize them to stay here and to live and work in Vermont. So one of the challenges we have is increasing that pipeline, and then the other challenge we have is keeping folks here when they graduate. So 2 more slides, just really quickly. What we did last year, we had a very aggressive legislative agenda last year. These were all recommendations out of the Rural Health Services Task Force report. We created a nurse scholarship program that the legislature funded with about $1.3 million. It's administered by VSAC. This has been amazing. By the time the budget was passed, VSAC literally had 60 days in November and December to get the program stood up, get the word out, get applications in, and they were able to they got almost 200 applications and they issued 71 awards for the January semester. They anticipate that the money will be spent for the 2021-2022 school year, and they're anticipating, at least 400 applications. So just an amazing thing, and certainly supports what the Rural Task Force was saying, which was that the cost of the educational programs, is a barrier for people, and we needed to provide some funding to help them access those programs. One of the other real challenges is for our nurse educator programs. They've really struggled to attract nurse educators, in particular clinical nurse educators. So, when you're in nursing school, I don't know if we have any nurses on the Zoom, but part of that experience is not just your classroom didactic instruction, but it's actually placement and sort of residency in different settings, hospitals, nursing homes, and other settings where they get that on the floor, on the ground experience. And the nursing programs haven't been able to attract those nurses. State rules required that a nurse have a master's degree, and fewer than, I think, 3% of nurses in Vermont have master's degrees. So it was highly competitive. They were unable to attract them. So we modified last year those requirements so that it's bachelor's level plus experience. They still have to meet their accreditation requirements, which does require a master's level, but they have some flexibility built into those accreditation standards. So with this change in state law, they have better access to qualified nurses to help provide that. And we're already seeing some of those partnerships between hospitals and skilled nursing facilities in particular, where the facilities are providing the clinical nurse instructor and working under contract with the nurse educator program. So it's a model that we hope can be expanded. We also made military medics eligible for licensure as an LPN. So they're automatically able to sit for the LPN examination based upon their training and education. Removed barriers to physician assistant licensure, also created a primary care scholarship, and then expanded telemedicine. Also created established a requirement for the Agency of Human Services to develop a strategic workforce plan. And that first report is due March 1st. For this
Laura?
year, yeah.
I didn't know, because I know you have a limited amount of time, and I see we have a question up. Are you okay with taking a question?
Sure, that's fine. It's hard for me to see the hand.
Yeah, that's okay. Representative Hango.
Actually, I can wait until this section is over because I'll be questioning this whole section. Thank you.
Okay, all right,
Sure.
Thank you.
So our priorities this year are passing the Interstate Nurse Compact. Last year it passed the Senate, it stalled in the House. Essentially what this would allow is for Vermont to become a compact state. Right now we have 34 states that are compact states. 10 states are pending. So right now Maine and New Hampshire are compact states. Massachusetts and New York are pending along with 8 others. So that will be 44 compact states. What that means is if a nurse is licensed in a compact state, that nurse can work in any other compact state without having to get a separate license. So for example, if you're licensed in a compact state of New Hampshire, you don't have to get a license in Vermont to practice in Vermont. We know that this is something that in particular our new nurses want. If we don't move forward and enact the compact, Vermont is going to be at a competitive disadvantage and will be one of a handful of states that is not a member of the compact and will be an island in New England and the upper Northeast region. So this is a really important priority for us. The governor proposed a nurse tax incentive program. So again, the compact was a Rural Health Services Task Force recommendation. Tax incentives were also a recommendation of the Rural Health Services Task Force. So the governor's budget proposal essentially provides an income tax exemption phased down and out over a 3-year period of time. So the first year after graduation from a nursing program, you'd be eligible for 100% tax exemption, 70% tax exemption in your second year, and a 50% tax exemption in your third year. This one, I can't deny legislators have been very hesitant about. I've testified, as has the administration and others in your House Healthcare Committee and your House Ways and Means Committee. So this one has met for the second year in a row with some resistance. I think it seems as though folks don't feel like it will do the job of attracting folks to stay in Vermont. Again, I'm focused on that 30% of nursing graduates that we lose, and a program like this could be very attractive to help us retain the nurses that we might otherwise lose. There's been some conversation around whether it would make sense if Vermont were to move forward with a tax incentive to broaden it so that it applied to new nurse grads who moved to Vermont from other states to take advantage of the tax incentive. We certainly, as a provider community, are very willing to entertain making this bigger and bolder. And also, I think there's value in having it be a 5-year program rather than a 3-year program. And maybe the benefit is less in each year because the longer they're here, the better it is. So we'll see where that goes. This one does seem to have a fair amount of hesitancy around it. The other thing we are looking for is ongoing funding for that nursing scholarship that I mentioned. So your House Healthcare Committee has recommended to the Appropriations Committee $3 million total over 3 years to be split between the nurse and primary care scholarships. The great thing about that program too is for every year of scholarship, that nurse has to commit to working a year in Vermont. So, or every semester is 6 months equivalent of having to work in Vermont. If they don't do that, then it converts to a loan that they have to pay back. So it's a great incentive. I did some work with VSAC and presented information to your healthcare committee. For every $1 million in nursing scholarship, we generate 1,000 commitments to work in Vermont. That's a big deal. And that will go a long way to making a dent in this problem. We had suggested $5 million in nursing scholarships to be spent over 5 years. And like I said, the healthcare committee did make a recommendation to appropriations, which is a wonderful thing. The other area that we are focused on is investing some funds to allow providers to support upskilling existing workers. There is a proposal that the healthcare committee recommended to, again, the House Healthcare Committee to the House Appropriations Committee, which would fund a joint endeavor between Vermont Technical College and skilled nursing facilities to create 40 LPN slots across the state so they could upskill existing licensed nurse aides to LPNs. So it would cover the cost of the educational program as well as provide for a living stipend. One of the challenges that folks face when they're trying to go to school and work, when they have to work because they are also raising a family, is their ability to reduce their hours and get through a program in a timely manner. So providing a stipend helps that individual to get through the program in a more timely manner and have some time to study and prepare and work fewer hours. So that has received support from the House Healthcare Committee, and my understanding is that and the scholarships would go in the budget. The other thing that we did as a rural health task force was, really identify the need to figure out a way to incentivize our low-income health workers. So some of the challenges, and some of the solutions that we've identified are looking at expanding the earned income tax credit for, healthcare workers like licensed nurse aides, personal care attendants, home health aides, it's just an area that we really struggle because it's not just about the wages. They then also bump up against the benefits cliff. If they make too much money and go over the cliff, then they lose their benefits. And that's definitely not something that people want to see happen. And there are broader benefits than the benefits an employer would provide in terms of, leave and health insurance and things like that. So we had recommended looking at the EITC and then looking at the benefits cliff. We are not experts in this area, as we've spoken with people, in state government who are more familiar with these programs. There's a lot of complexity to that, and that's above my pay grade. But, I think it's important to recognize that we've got to find, some ways to incent those workers. We do have opportunities and providers are accessing this through VSAC, through the state advancement grant to cover the cost of LNA training. Right now, providers either pay for it or they try to do some combination of paying for it in combination with these advancement grant dollars so that there's no cost, certainly to the individual. And then again, we just think a statewide marketing effort. Vermont's a great place to live. We have a high quality of life. And, we think we should seize on the opportunity, given the great work that we've done in Vermont to manage this pandemic, to try to attract people to come and live and work here and work in healthcare in particular and in long-term care. And really, long-term care is a challenge, as many of you know. It's a tough thing to do. It requires a certain type of person to want to provide long-term care services and support. So I think it's also a great thing about the partnership between the skilled nursing facilities and VTC, because it really is intended to help grow long-term care nurses, which are desperately needed across our continuum. So I'll leave it there. If you've not heard from your providers yet on these issues, I expect you will any day now, is my sense. As these things are moving and advancing pretty quickly through the State House. So happy to take questions. I know Representative Hango had her hand up earlier. Let me stop sharing my screen. There.
Go ahead.
Thank you. I'm sorry. The answering machine was just picking up, so I didn't want to unmute right away. But I have one quick question and some comments. I'll make my comments first. I really appreciate everything that everyone has done in the legislature to promote nursing in the state of Vermont. I sit on the board of a home health agency, and I know the challenges firsthand for finding employees and retaining them. Today, we'll have a bill introduced, H332, that Representative Durfee and myself worked on, and it basically piggybacks on Act 155, but is for physician assistants.
I did see that, yeah.
Great, okay, so if you all want to take a look at it, we would appreciate everyone's thoughts on it. Mm-hmm. My question is, in one of your first slides with the 70% students after graduation staying in Vermont but losing 30%, do you know of that 30% if they were out-of-state students to begin with?
So some of them certainly were, and by and large, the out-of-state students are attending UVM and Norwich, by and large.
Thank you.
Mm-hmm. I'll make one other comment on the nurse tax incentive because I think it's important. Maine has a very robust, Maine's the oldest state in the nation, and they have an opportunity tax credit program that is attracting new grads from just about anywhere, including Vermont. It's a $17 million tax credit program. So that's our top competition for fighting to help change some of our demographic.
Great. Yeah, I was thinking the same question when you were presenting. So thank you for asking that, Representative Pango. Looks like we have a question in the chat. Molly, would you like to raise that question?
Sure. Thank you, Laura, so much. This was a great presentation, and thank you for everything your organization is doing. I just was curious when you were talking about that particular upskill training program that House Healthcare had recommended. Is that specifically for skilled nursing facilities, or is that for the continuum?
So the placements will be in the skilled nursing facilities. They'll upskill their existing staff. Who knows ultimately where they end up. But the idea is to be able to grow those long-term care nurses. And skilled nursing facilities are a great way to do it because you can get efficiency with the classes. And also they have the structure in place to do the clinical oversight and the clinical instruction. So we're starting there. This is the first time we've ever tried to do a program like this. And it was ready to go before the pandemic. And the nursing homes were going to try to support the tuition until the pandemic. And now they don't have the cash flow, especially with the amount of money that's going out to cover the traveling staff.
Okay, thank you.
Laura, can you tell me whether or not the tuition programs included a requirement to work in Vermont healthcare for any period of time?
Yes. So for every year of scholarship, you owe a year of committed service to a provider in Vermont.
Okay. And the other things I just wanted to let folks know about is that our committee is going to be taking up next week H153 that deals with reimbursement rates for home and community-based providers, which has been something that has plagued, particularly in the long-term care industry, plagued our community providers, some of which Laura represents.
I can confirm, if you have not yet heard from your home health agencies, your residential care homes or assisted living on that, you should be very soon. So they all know where to find you.
And Laura, you should be getting an invitation to testify in committee when we get back from break.
Okay, great. Happy to. No, that's very important. And, we're also asking, just so you know, for that group of providers, also looking for an increase for the choices for care services rates. So ERC and asking for that. So.
Great, thank you. Do you have time for one more question or?
Sure. Yeah, yep.
All right, if there's any questions, got Laura for a little bit longer here and then, all right. I'm not seeing any, but I will, if you could send me, do you mind if we share your presentation? I can send it out to the group.
Sure, absolutely. I'll send it to you. And then if anybody has any follow-up, questions, please feel free to reach out at any time. I'm happy to. I've got tons of data. I didn't want to put you to sleep with a lot of data and graphs and charts, but there's a lot to back up what we've been asking for. So happy to share.
Great. Thank you so much. Lots of really good information there for sure. It's definitely something that we were going to be talking about. So
thank you.
Thanks again.
Thank you.
So a little bit short today, but that's good. Been a lot going on for sure. Does anyone have anything else they want to bring up while we're all together here? We can see if there's any hands over here.
Dan?
Yes.
I might just let folks know that it does look like the Healthcare Committee is going to take up the hearing aid bill after, I'm trying to remember the number, 233. Is that the right number, Ruby? Anyways, I can't remember the exact number, but the Healthcare Committee is going to be taking up that bill. It is going to be after crossover, so I'm hoping that they're going to maybe turn that into a committee bill or something to make sure that it moves along. But they've asked for, a list of potential witnesses and things like that. So that would be a great step forward too, if we have the ability to move that bill. 266. Okay, thank you.
Yeah, thank you for that. Good. And maybe coming up as that moves forward, we could maybe get an update on 266 as it moves. So
yeah, I think that would be great. And anybody who has an interest in that bill, if you want to contact the Healthcare Committee to express your interest in them taking that up, that's also
Yeah, and I
positive.
see Ruby's got her hand up, so.
Well, just to follow up with on what Representative Wood was saying about that bill, COVE has been facilitating a coalition of non-representatives. So if there are people on this call who want to participate in some of our sort of grassroots actions and organizational actions, we have templates, we have media resources, we have logos and talking points and all of that. So if there are people on this call who want to get involved, feel free to contact me. I'll put my email in the chat. And if nothing else, we will be posting regularly on our Facebook page, and you're welcome to share and like and do whatever with that. But feel free to reach out.
Great, thank you so much. And we'll make sure we include Ruby's contact information in our minutes when I send it out.
I guess maybe, Dan, the other thing we should mention is that because this does affect older Vermonters, and that we have a lot of folks who are caregivers out there for grandchildren or other, raising their children's children, that we are working feverishly on H-171, which is the child care bill. And that does, people don't think about it impacting older Vermonters, but it definitely does. And so our goal is to have that out of our committee by the end of Friday, because it needs to travel around to several other committees and hopefully be on the House floor sometime later in March. So that is another bill that does impact older Vermonters and women in particular, I will say.
Thanks for bringing that up. That's so true. Mm-hmm.
It looks like Mark has a question.
This is Mark Boutwell with Senior Solutions, the Council on Aging in southeastern Vermont. And it's great to see the incentives for skilling up. As a representative of the Agency on Aging, where we provide lots of service to home-based services, I was struck by the statistic that the fewest number of providers in that chart were the lowest level of providers. And I just have to stress that, those are the people that we're working with. Those are the shortages that we're seeing are dramatic. Getting personal care attendants into people's homes and keeping them when they can get a job at Home Depot for a better wage. So it's really, I just want to shout out to the importance of looking at the whole spectrum of those providers and finding incentives to bring people in at that lowest level and support them. Because for all the 5 agencies on aging, I see Meg Burmeister here, we're supporting those older Vermonters in their homes, and they're critically dependent on these PCAs and home health aides. Thank you.
Thanks for bringing that up, Mark. And I want to point out and call out that is, again, an issue that is a women's issue as well, because a lot of those folks happen to be women, and it's also an issue of equity in terms of our BIPOC community, because a lot of folks enter into the workforce in that way. People, new Americans, and people who have immigrated to the country. So I think that's an important issue to call out. I think that Meg has her hand up.
Yeah, I just wanted to, thank Mark for bringing that up. It's really an important piece for the work that we do to help bolster home and community-based services. Without those workers, that system fails. And it's really critical that they begin to be recognized for the importance of the work that they're doing and the critical function that keeps people in their homes. These are people, by and large, being paid an hourly wage with no benefits, no vacation time, no sick time. And it's really, a terrible way to position people and not really raise them up to the kind of work that's so critical in making the opportunity for people to live at home. And we see that, the number of people wanting to stay home every year is growing and increasing. And we just need to really recognize that.
It's another reason why the Medicaid home and community-based services rates bill is important as we try to continue to really make sure that people have real choices in terms of where it is that they want to be. And that's sometimes those choices end up being made for people because there isn't somebody who they can find to provide the care in the home, or that the family might need some respite support or some personal care support, or the adult day. Think about the adult day programs as well. They're hiring this group of people as well. So appreciate everybody bringing that to light and putting a spotlight on it.
And kind of around the same lines, I just want to let people know that there is a public hearing on Wednesday, the 25th, on the renegotiation of the global commitment waiver. So I just want to throw that out there. If you've got any concerns you want to pass on, and I can point some information to folks if they're interested.
Susan?
Yeah, I wanted to piggyback on a comment that Lynn Burdett made. I'm a newer case manager. I've been here about 1.5 years for Senior Solutions in Brattleboro, and it has really been an ongoing problem for us to take on new clients, first of all, because there aren't enough home providers to go into the homes, but also with existing clients, they have people quitting and leaving, and so they become reliant on having this care scheduled, and then somebody leaves or somebody's sick and they don't have a replacement. I guess my question is, being a newer person, we have 2 agencies that Medicaid will support through the Choices for Care program. So we have Bayana and we have the BNH. And I guess my question to the representatives is, what can we do to allow other agencies to be approved to work? Because before the pandemic, we were already short-handed. And now with the pandemic, we've lost home providers who tend to be on the younger side. So they have children, and we lost a lot of them to stay home with their kids and provide their home-based needs. So that's my big question: is what can we do to get other agencies approved under the Medicaid? Thank you.
It's a good question. I think that's a bigger question than we have time to discuss today, but I know that Angela Smith-Jane from Dale is on the call. That's also something for them to take note of. I don't know if Angela has any comments that she wants to make with regard to that.
I've been taking notes definitely on all of the comments because they're all really, really good points and important points. My understanding is that the current moratorium on adding new providers for Choices for Care, Susan, to your question, is through 2025. So that would have to change legislatively in order to be able to open up for more providers to directly bill Medicaid.
Joanne, I saw you had a question or a hand up, Joanne. We can't hear you, Joanne.
I'm just curious to know who pays for the traveling nurses.
We all do.
Right. So, and how much do they get an hour?
I don't know what their wages are, but you could see the dramatic increase. They huge. Obviously,
it's
yeah, I don't
differential. Know. So isn't there a way that people would understand if you bring up the pay scale for the home health people, that will keep people in their homes then the people who are paying the travel nurses in the facilities won't have to hire so many travel nurses because there'll be less people going into facilities.
Yeah.
And won't that just help the overall economy?
I think that people definitely get that.
Okay.
It's kind of like having the workforce there, so needing to develop that workforce it's kind of like what I call bridge funding. Needing to be able to bridge the point where we have sufficient people in the workforce to meet the demand.
Right.
While we don't have that, you have to spend in both areas, and so then that becomes a cost factor. But yes, you're absolutely right, Joanne. I mean, when you saw the figures double in 1 year in terms of what Laura was showing us, that's real money. It's money we are all paying, it's an obvious change, but got to do both at the same time. Which right now, that is what we're doing. We're paying for scholarships and assistance in that area to recruit new people. And you saw the list of things that have already been done to try to expand the workforce. Dan will be sharing that out, so you can maybe take a closer look at each one of those acts so you can see what that is. And at the same time, we're trying to expand this workforce. There's lots of workforces we're trying to expand. So it is an obvious thing. But thank you so much for mentioning that. I think what we're going to do is, Dan, I think we're ready to wrap up. Let people, the legislators on the call, get a little break for lunch before we go on the floor, and hopefully everybody can enjoy a short walk out into the warm weather. I understand it's warm.
No, I just had all the snow come off the roof. It shook the whole house. I gotta go see what happened.
Uh-oh.
I heard it a few seconds ago. It was pretty loud. Okay, cool. Great. Thank you, everybody. And like I said, I'm going to try to put something together for housing for our next caucus when we get back from town meeting break. So there'll be nothing going on next week. And then we'll be back the week after. So
Thank you.
Thanks,
great.
everybody,
Thank you,
for being here.
for coming today.
Thank you.